India is now getting support from around the world. Thankfully, of course, we've been watching images of these planes bring in oxygen cylinders, equipment of all sorts, so badly needed. British doctors of Indian origin are chipping in with support of quite another kind, very material in its own way. The British Association of Physicians of Indian origin, BAPIO as it is called, has set up a virtual hub.
Virtual Hub is offering three kinds of services. One is reporting on CT scans, because a lot of patients are getting CT scans done, but because of the workload and increased demand, the reporting is not being done for 3-4 days. So what Virtual Hub will offer is reporting in the UK on those scans who are not being reported. So timely reporting, early treatment. The second stream of Virtual Hub is to have clinical discussion around cases for benefit of both parties to those health officers who are working in remote areas, remote health centers. And the idea behind that is to help them triage patients and largely keep those patients home who can be kept at home, thereby reducing the pressure on the hospitals. And the third bit is directly targeted at reducing the burden on healthcare workers or doctors in hospitals, because there are two types of patients in hospitals. One who are extremely unwell and require intensive care. So the hospital doctors are currently stretched out across the whole hospital. So what we are offering is a service of consultation or virtual ward round to those patients who are not that unwell but still are in hospital because of oxygen requirement. So they are a different category of patients. And through our virtual ward rounds, we with junior doctors, we can look after those patients, thereby allowing the senior other doctors to concentrate on unwell patients. So reducing their exhaustion, reducing their burden.
Treating patients virtually is not unknown anymore, even if that may be limited. But this is not about interacting with patients directly, not even in a virtual sense.
There needs to be a governance around the whole process, because we need to protect the doctors who are giving advice. So talking and giving advice directly to the patient is outside the governance criteria, and also exposes doctors to medical, legal and regulatory issues. So we don't want to do that. And moreover, it alienates the local doctors. If we are talking and giving advice directly to patients, then the local doctors won't be on board, and that will create a sense of disharmony between the patient and the local doctor, because ultimately it is a local doctor who has to prescribe the medicine. Ultimately it is a local doctor who has to take responsibility. Therefore we decided to take local doctors on board, keep them completely on board and have that discussion. Indian doctors don't need expertise, they know what they're doing. It's just that currently they are exhausted. So all we are trying to do is to increase the manpower virtually to help them reduce their exhaustion. And what we are trying to do within our framework is we are establishing links with the organizations, with hospitals, rather than individual doctors. Again, to have proper framework and protection for all.
The response from doctors has been quick and it is accelerating.
We have received outpouring of support from various quarters, including a lot of doctors from different origins. So far, we have received expressions of interest of volunteers of approximately 250 doctors. We are aiming to be 1,000 doctors by next week. So there is overwhelming support from doctors within the United Kingdom. People are prepared to spend or to contribute half an hour or 1 hour every day or a couple of times a week using their personal time. And certainly, they are not expecting any remuneration at all.
The initiative has gotten off the ground quickly. It had to.
The virtual ward round is going to start next week, and the first hospital we have chosen is Kingsway Hospital, Nagpur, because they have taken over care of extra 200 patients of COVID who are not that unwell. So to reduce the burden, we are going to look after some of the beds as a pilot and then gradually scale it up. Our second project, which is lined up for virtual ward round, is going to be in Delhi NCR region.